I was talking with you the enzyme in my previous lecture, and in that, in part one, I was in giving you the classification and some properties of the enzyme. And today, before proceeding to the second part of my this topic, you are going to have your test on 28th. Topic is the vitamins, and for that, your preparation for that topic, I have gone already with you in small group discussions, and tomorrow is your grand tutorial. So you will definitely be pairing in that grand tutorial. In that grand tutorial, overall preparation will be looked into, and you will be prepared for that. And then on Friday, there will be your test on the topic of the vitamin, and you must participate in that test. Now, when I was talking of my previous lecture, I finished that on the equation, that is the mental Michael's mental kinetics equation, and what I want to show you in that equation is that first of all, before understanding this equation, we must know that how the enzyme substrate reaction taking place, and for that I would like to write down that is the enzyme plus substrate, and when they react with each other and they form a complex, that is the enzyme substrate complex. Now, this enzyme substrate complex, the kinetic is K1 here, and this complex further then is processed in the reaction process. Its cleavage is taking place, and in that the enzyme is liberated as such, and the P product is formed. So this equation can very nicely, where E is the enzyme, S is the substrate, the ES is the enzyme substrate complex here, and P is the product. So it will give you an outline, an idea how enzyme substrate they will come in action with each other, and the product enzyme substrate product is formed, the complex is formed, and that further processes that the enzyme is then again regenerated and the product is formed. Now in this equation, if you look that V0 is the velocity, initial velocity reaction, Vmax is the initial the maximum velocity. Max stands for maximum, and that is indicating maximum velocity, whereas Km is the Michaelis constant, and that is K1, K2. Overall, it is K1, that as I showed you here in the reaction, that K1 is there. And S is the substrate concentration. In your exam, there is no derivation of this equation, but you must know what is this equation, how to write it down. Sometime in the question there is write down the Michaelis-Menten equation, and its significance is then asked for that. Now, there are certain assumptions of we have made certain assumption in driving this equation, and first assumption is that the relative concentrations of the enzyme and the substrate. We have to find out, we have to see how much substrate and how much enzyme, what are their concentrations. The concentration as written here, the concentration of substrate is much greater than the concentration of the enzyme, then what will happen? Definitely, if the substrate is more, is greater, and enzyme in small quantity, the percentage of the total substrate bounded by the enzyme at any time is small, definitely. That is a big area. The enzyme is in small concentration and the concentration of the substrate is greater. So the percentage as a result of this will more substrate, little enzyme. As a result of that, substrate, enzyme substrate that will be formed, that will be in that the enzyme at that time will be very small. Percentage of that will be small. And second assumption, what we assume from this equation, that is Michaelis-Menten equation, that is the steady state assumption. It's very good to understand steady state assumption, and that indicates the reaction, formation, and the participants, their ratio is the same, what is going to happen. He says here that the ES, that is the ES is the enzyme substrate, enzyme and it is the substrate. That does not change with time. This is the steady state assumption. That is the rate of formation of the enzyme substrate is equal to that of the breakdown. Very good. Here, the rate of formation of enzyme substrate complex is equal to that of the breakdown of the enzyme substrate, and as a result of breakdown, I told you in the beginning that the enzyme is regenerated and the product is formed. Now this state is in an equilibrium, it is in its steady state. In journal, intermediate in a series of reactions is said to be steady state when its rate of synthesis, this is important, when the rate of synthesis is equal to rate of degradation. So, as I told you in my one lecture, we were talking of the nitrogen balance. I told you that the intake of, in a normal healthy person, intake of nitrogen is equal to the excretion of the nitrogen, and that is the nitrogen equilibrium is there. Similarly here, if you see that the synthesis in reaction is equal to the rate of degradation, it is called as the steady state, and that is the steady state assumption. Then initial velocity, as I was talking to you, V0, when I was telling you here, that is the V0. What is initial velocity? They are used in analysis and reaction. What that indicates, the rate of the reaction is measured as soon as enzyme and substrate are mixed. You now can understand it, that as soon as the enzyme come into contact with the substrate, there is a rate of reaction starts there, because they are reacting with each other, in action with each other, the rate of that will be started. But at this time, it has just started. The product is, amount of the product, the concentration of the product will be very small. Initially started, the enzyme and substrate, they came into an action with each other, and at the beginning, the product concentration will definitely be small, and therefore the rate of back reaction from the product to substrate can be ignored. So at this stage, no question of looking into the reversible reaction. That is why here in that equation in the beginning I mentioned that when enzyme plus substrate, they form a enzyme substrate complex, that is reversible reaction. Whereas when that substrate and enzyme come into an action, the rate of velocity V0 is small, and in that case the enzyme plus product is formed, and this reaction is irreversible because the amount of that substrate, the amount of that product formed is very small, so no question, we cannot think of going back there, like looking there. So that is the initial velocity of that. Now, in this equation, that is the Michaelis-Menten equation, there are, I told you that there is a, no, coming back to this Michaelis-Menten equation, there is then characteristic importances of certain the values here, and what we conclude from all this, what I have taught you, is that what is the characteristic of Km? Here it is Km. What is the characteristic of the Km? Km, now listen, Km is numerically equal to the substrate concentration at which the reaction velocity is equal to the V max. So then second is here small km. It is km, then there are small km. What is a small km? The small km reflects a high affinity of the enzyme. It will indicate the high affinity of the enzyme for substrate, the small km. And large km is, it reflects a low affinity of the enzyme for substrate. So, very clear now. While talking of the characteristics of Km, there are two types of Km. One is small Km, one is large Km. The small Km, that indicates the high affinity of the enzyme for substrate. Whereas large Km, it reflects a low affinity of enzyme for the substrate. Then the important conclusion, we have to now see what are the order of the reactions. If we see, when S is much less, that is substrate here, when the substrate is less, what is going to happen? It is here, when it is in low amount, the substrate is low, then velocity of the reaction will be approximately to the substrate concentration. The V max, I told you, that will be there. We can divide these order of reaction into two forms and two categories. That is the first order reaction and this is first order reaction and the second order reaction. First order reaction, the rate of reaction is, what is first order reaction? When the rate of reaction is to be, you can call it like this, when the reaction is to first order when respect to substrate, when substrate is much greater, when the S is much greater than Km, the velocity is constant and equal to max. So that will be known as the first order reaction. The second order reaction is the rate of reaction is independent of the substrate concentration. There in the first order reaction it is not like that, whereas in the second order reaction the rate of reaction is that is independent substrate concentration, and the enzyme is saturated with substrate in that condition and is said to be zero order reaction also with respect to the substrate concentration. Then now coming to the inhibition of the enzyme activity. After this first order and second order reaction, I will go for the next is the inhibition of the enzyme activity. You see, it's very interesting. Any substrate that can decrease the velocity of the enzyme. Now, what is inhibitor? Any enzyme that decreases the velocity of the enzyme catalyzed reaction is called an inhibitor. This is definition, inhibitor. Inhibitor, we can divide it in two ways, two forms. One is the reversible and the second is the irreversible inhibitor. Now, first let's take what are the irreversible inhibitors. These are those, I'm talking the irreversible inhibitors here now. If you look into that what are the irreversible inhibitors, we can say these binds to enzyme. These inhibitors, they bind to enzyme through covalent bonds. Irreversible, I repeat, the irreversible inhibitors, they bind to enzyme through covalent bonding, through covalent bond. And lead is example of that, which it combines with the enzyme through covalent bond with the sulfahydryl side chain of the cysteine in protein. This is one example. There are many examples in heme synthesis. They are irreversibly inhibited by lead when the heme synthesis is taking place, and this is how these irreversible inhibitors, they affect the synthesis. And another important group of irreversible inhibitors are they are mechanism-based inhibitors. In the first, it was just connecting through covalent bonding, where in second, there are another group, which is mechanism-based inhibitors. They are converted by the enzyme itself to form that covalent linkage to the enzyme. Enzyme itself is adjusting itself. That is mechanism through a mechanism, thereby inhibiting it. They are referred to as suicide inhibitors. Those irreversible inhibitors that act on a mechanism-based system, they are converted by the enzyme itself to form that covalently links to the enzyme, thereby inhibiting it. Then they inhibit that. They are referred to as suicide inhibitors. This was regarding irreversible. Now coming to the reversible. Here it is the reversible. Now these binds to the enzyme through covalent bonds and thus dilution of the enzyme inhibitors. Due to these reversible inhibitors, though it is through non-covalent bonding. In the case of irreversible, it was through covalent bonding. I repeat it again, the difference between the irreversible inhibitor and reversible inhibitor. Irreversible inhibitors, they bind to enzyme through covalent bond, whereas the reversible inhibitors, they bind to the enzyme through non-covalent bonds. And what they do, thus there is dilution of the enzyme inhibitor complex that will be diluted and results in the dissolution of the reversibly bound inhibitor and recovery of the enzyme activity. So this is the difference between reversible and irreversible inhibitors. There are two most commonly encountered types of the reversible inhibitors are, when we are talking of the reversible inhibitors, and in that these are the inhibitors in which they combine to the enzyme through non-covalent bonds, and they, as a result, there is a dilution of the enzyme inhibitor complex that results in the dissolution of the reversibly bound inhibitors and recovery of the enzyme. And they are of two further we can divide these into competitive and non-competitive inhibitors. If you go to your book of Lippincott, page 60, that book has given a very nicely the effect of the competitive inhibitors. In that connection, effect of Vmax, what is the effect of Vmax in that, and effect of Km, and the effect on the Lin-Weaver-Burke plot that has already given in a nice way there. You can go through there. Then there are certain drugs there is sometimes question in the university paper that the role of drugs as inhibitors. I have tried to explain you here that what are the effects of certain drugs, and particularly the book and has mentioned in your syllabus is the statin drugs. Now, what are these drugs? You know, you have gone through the lipid profile. When talking of the lipid profile, can you tell me what are the lipid profile? Number one is the cholesterol. Number two, triglyceride. Number three is the HDL, high density lipoprotein. And number four is the LDL, low density lipoprotein. This is the lipid profile you have gone through in your the chapter of the lipids. Cholesterol, triglyceride, HDL, high density lipoprotein, and low density lipoprotein. Then we studied and we saw there the effect medically, what is the effect of these cholesterol forms in heart attack and certain other diseases, that is particularly LDL, low density lipoprotein, very dangerous. They are also known as the dangerous cholesterol or the dangerous lipid. So these statin drugs, what I am now coming back here is the statin drugs, that is they are ये था ये
नहीं था,
इनका ये नहीं ली थी फोटो,
नहीं ये ली थी,
ये मैं क्या था. Anyhow, the statin drugs, they are example of the competitive inhibitors, and this diagram is very nicely explaining. When I was telling you that the lipid profile, in that I told you about the cholesterol, triglyceride, HDL, LDL. You see, when the level of the cholesterol increases, then the drugs are used. They are known as the statin drugs, and they inhibit these statin drugs. They inhibit the rate-limiting step in cholesterol biosynthesis. This is here. It is indicating that the what is the particularly talking of the reaction is catalyzed by, there is a one enzyme that is catalyzing the reaction. Not talking that because the statin drugs, they will be acting through this process, that is the HMG-CoA. Now, HMG-CoA, that stands for hydroxyl methyl glutaryl CoA reductase. It is an enzyme. And the drugs, it is coming into action, it is joining here, that is the, paravestane is one of the statin drug, and this is how this is coming in and in action with this drug, and it will stop the formation, it will stop the rate of reaction for the synthesis of the cholesterol. So this is the action of the statin drugs. And statin drugs, particularly when talking, you must remember HMG-CoA reductase, because this enzyme is important to stop the excessive formation of the cholesterol. There are other statin drugs, that is the atorvastatin, and given in your book, they are analogous to the natural substrate for the and they inhibit the HMG-CoA reductase. And by this reaction, as I told you, the de novo synthesis, cholesterol synthesis is stopped, thereby lowering plasma cholesterol level. Then enzyme that inhibitors as a drug, there can be a question that there are certain enzymes used as a drug. It reflecting the in that case, particularly mentioning the 13 lectin antibiotics such as penicillin, now here is that of particularly explaining antibiotics, and such as penicillin and amoxicillin, they act by inhibiting enzyme involved in the bacterial cell wall synthesis. This is how, the penicillin function as an antibiotic, and amoxicillin very important. These at one time the penicillin was life-saving drug when in the beginning it was discovered, and similarly here. And so what they do is they inhibit the enzyme involved in the bacterial cell wall synthesis. They don't allow the bacterial wall cell. When wall will be not formed, then the next further process will be formed. And then these drugs may act by inhibiting extracellular reactions. On one hand, bacterial cell wall synthesis rate limit. On the second, the extracellular reaction, they inhibiting the extracellular reaction. This is illustrated by that one example of extracellular inhibiting reaction is that of the angiotensin converting enzyme, that is ACE inhibitors. They lower blood pressure. These enzymes, that is the angiotensin converting enzyme, ACE inhibitor, they lower blood pressure by blocking the enzyme that cleavage the angiogenesis, and that cleavage the angiotensin 1 to form the protein that is the potent vasodilator angiotensin 2. There is formation of angiotensin 1 to angiotensin 2, and they act in that process. These drugs, they include there are many drugs, the capetopril and their many name also, they causes vasodilation and therefore a reduction in the blood pressure. Aspirin, a non-prescription drug, irreversibly inhibited prostaglandin, and there is thromboxane synthesis also there is that. And now this diagram, a non-competitive inhibitor binding to both free enzyme and enzyme substrate. This is at the same time indicating that the enzyme, as I told you, then coming in action with the substrate, forming the complex, that is the EX complex, and in that case, that inhibitor here then coming in action and combining here with the EX complex in making it inactive, and this inhibitor, this is indicating that it is also an enzyme substrate inhibitor complex, and this is how this enzyme, and this is here, it is completely inhibiting, and that will not allow the reaction to proceed further.